Welcome to Menopause Made Simple Part 3. This video will be on the management of menopause. How to manage? Well, it is the right approach to management of menopause that is critical. Obviously, assessment of her symptoms, whatever is present, her personal needs as a woman, her specific risk factors, whether it's breast cancer, endometrial cancer, and her family history, whether it's a family history of cardiovascular disease or breast cancer. But the ultimate question is, will any of the available options ultimately improve the quality of life for the woman? Preventive measures for menopause. How can we modify the increased mortality and morbidity in our older women? We all know that with increasing age, there's an increased risk of death and illness. Well, smoking cessation to prevent lung cancer and maybe also to reduce alcoholic intake. You screen for breast cancer risk as per country protocols, taking into account her family history of breast cancer, her age of menarche and onset of menopause. Obviously, if there's a longer period of estrogen exposure, she's more at risk of breast cancer, and age of first pregnancy. The earlier the age of first pregnancy, the lower the risk of breast cancer. And preventive measure, whether the patient has frequent self-examination or by the doctors, whether she has annual mammograms, especially in women who are older than 40 years of age. Her cardiovascular disease risk profile, if you take into account her family history, whether she has a high blood pressure, whether she's diabetic, whether she smokes, what's her cholesterol level, whether she's sedentary or she's active in terms of exercise, and you have to take into account her dietary habits. And obviously, whether she's been screened for cancers like colon, ovarian cancer, or uterine cancer in the past. And obviously, for her bone health, has she had a bone scan? Well, diet and exercise. Diet and exercise and weight control are important in determining a woman's risk for cardiovascular disease, osteoporosis, diabetes, breast cancer, and depression. Menopause is a high-risk time for weight gain. Together, diet and exercise are crucial components of preventive medicine for women pre, peri, and post-menopause. Aerobic exercise modify our lipoprotein levels in terms of the good and the bad cholesterol. Brisk walking and vigorous exercise are strongly associated with a reduced risk for coronary heart disease. Weight training, progressive resistance training, and weight-bearing exercise have been shown to be effective in increasing the bone mineral density, hence reducing osteoporotic risk fractures and preventing falls in older women. So, in summary, diet and exercise is good for bone physiology, the mood, and coronary cardiovascular disease. Supplements. Calcium and vitamin D are important adjuncts to treatment and preventive health programs. Vitamin D, together with hormone replacement therapy, provide a bone-sparing effect that is superior to that of hormone replacement therapy alone. Calcium supplements should begin before menopause. Calcium carbonate 500 milligrams daily in premenopausal women prevents bone loss, allowing them to enter menopause with a greater bone mass, which may reduce the risk of later bone fractures. So in summary, supplements are good for bone physiology. Therapeutic options. What are the reasons for interventions? Is it because of symptoms like hot flushes and other vasomotor symptoms? If yes, then you definitely should consider short-term therapy of various sorts, HRT or other adjunct treatments or supplements. But for the postmenopausal woman who has no major complaints, but is concerned with osteoporosis, I mean, if she's 60, there's no point considering HRT or hormone replacement therapy, but you could consider natural supplements or non-hormonal treatments like bisphosphonates for osteoporosis or selective estrogen receptor modulator or SERM for her osteoporotic concerns. Estrogen for vasomotor symptoms. Natural vitamin E supplements are proven to be helpful. Black cohosh and soy-based products have been shown to be effective for hot flushes. There are claims that bioidentical hormones are safer and more effective than traditional hormone replacement therapy because they are identical in structure to those produced in the body. But these claims have not been confirmed by large-scale reputable studies. The FDA urges caution when using compounded products. I'm not for or against, I just do not know enough of particular groups of people promoting their bioidentical hormones. Practitioners claim these hormones are natural and safer, alternative to standard hormone replacement therapy medicines. However, bioidentical preparations are not recommended because they are not regulated and it's not clear how safe they are. There are no good evidence to suggest they are safer than standard HRT in the long term. However, in the short term, I'm sure they are effective for control of vasomotor symptoms, etc., etc. Others, bisphosphonates for women with or at risk of osteoporosis who have contraindications to hormone replacement therapy. Osteoprotegerine for osteoporosis, it's an injection. Raloxifene, it's a selective estrogen receptor modulator, help increase bone mineral density. Clonidine to reduce hot flushes. Paroxetine, which is a selective serotonin reuptake inhibitor to reduce hot flushes. And gabapentin, which is an analog to gamma aminobutyric acid, which is able to reduce hot flushes. So, thank you for listening. The next video will be on hormone replacement therapy. So, thank you for